Okay, this video will cover documentation and documenting procedures. This is probably the biggest downfall of Paragon, is the poor documentation, and it's something that's a problem. So documentation is something really important to try to do your best on. So we're just going to grab a random chart here. I'm going to click on the patient and make sure it's added to my work list. Now I want to make sure I'm documenting on the right patient. I'm going to go to documentation. So here you could see prior documentations. If you wanted to review the patient's past notes, you can filter them down between the ED notes, discharge summaries, etc. For our notes, we're going to go to favorite note templates each time. And you can see basically the only things we can choose between are emergency department reports and central line procedure notes. I think there's also a moderate sedation one that we might have to use for the pre-moderate sedation. But for general documentation, you're going to do emergency department report. And unfortunately, there's only one template. It's not like a lot of systems where you're going to be able to choose a chest pain template, abdominal pain template, etc. You're going to put your date of service and time that you saw the patient here. And I should have mentioned that, let me go back out of here. If you are a resident or a APP, you might have it. You're going to have a different option here, and it'll tell you your option of what you're supposed to use in orientation. I don't remember what those are called, since these are my only options, but the documents pretty much look the same. It's just what you would choose. So it could tag you as a resident or a PA or MP. So, the residents would put the attending physician. If you want to type the primary care physician here, you can. There's a lot of basically just fill in the blanks, as far as there's not prompts or minimal things you need to do for like the HPI. The HPI is completely free text or dictated. So you can't, you have to be mindful that you're including at least 4 elements for the HPI so we can have accurate or maximize our billing. So you basically you can use your Dragon and dictate it. I can't show you Dragon on my home computer, but you would just free text here whatever you wanted to for the patient. There's not going to be anything that says you need to do 2 or 3 HPIs. You're going to have to make sure yourself that you've dictated enough. So you go to your HPI, and then the other thing that stinks is that the past medical, past surgical history. Thankfully, this patient, it's included. That means they've been there before, and the nurse has included it. You never want to click on this part because that's going to take you basically to the nursing section, where you would fill it in yourselves and incorporate it to the chart. It's a big pain. If they have nothing here, we need you to type either negative or some kind of medical history and surgical history so we don't get downcoded. So you could free text hypertension and negative or API, whatever you want, but this isn't going to get saved in the note. It's going to get saved in your note. It's not going to get saved in the system to populate next time. Let's see what happens, if you clicked on this part. It's going to take you out of your note into this whole other screen that the nurses do, and you just don't want to go there. And I'm probably going to have trouble just even getting out of here. Return to documentation. Yeah, see, this is why you never want to do it. Okay. So, here, this patient had medicines and allergies in there. It had the social history. A lot of times this is completely blank, so you would fill in what you can, basically. Review systems. So you can free text your whole review systems here, or you can go into Dragon, and if you have your Dragon up, remember when you log into the computer, you then need to log into Dragon. So if you had your Dragon on right now and you used your command, like my command is just review systems. So I would just put my Dragon here, push on the button, say review systems, and it would all populate right there, and I'd be done with my review systems, except I would highlight what was not normal and then dictate, the abnormal. If you don't have, if you're not going to use your Dragon, you can free text the whole thing, which would be a huge pain. Or you can, if you do the click here to complete, it's just a box where you can check. You can check the all systems reviewed in negative, and you can go through and do this and add a comment in the bottom, just like most systems. But it's just kind of a slower than using your Dragon, but it is an option. If you hit OK, it would populate right there. So you go down to the physical exam, you can put your vitals, they're reviewed, you can free text anything. And then the physical exam, same exact thing as the review systems area. You've got your blank part where you could free text or drop a Dragon macro in there, or just dictate it through Dragon. So I would just, my Dragon prompt would just be physical exam or physical exam minor, and it would auto-populate the whole thing here. Or you could again just speak it, or you can click on this and click through. You can put Pierce stated age if you want, and then mild distress. I ask that you never click no apparent distress. It's something that for some reason we all start doing early in our career, and I'm not sure why, but a lot of insurance companies will try to deny an emergent bill because we're saying that they're not in distress, but they're in the ER. And you can go through and click what's normal or abnormal, free text, or dictate in whatever you want. But again, you have to really take care of your chart and make sure you have enough review systems and enough physical exam elements that you're not going to get downcoded. So I recommend just doing a full review systems and a full physical exam and let the billing company decide what level chart it is. So if there are labs back when you are doing your note, they will auto-populate here. Now let's say you start your note and there were no labs, or the labs were incomplete. You just go to this little refresh button and you refresh the data, and it'll put in the rest of the labs. Here's where you would do your pulse ox. It doesn't really have a spot for saying who is interpreted by, which is something that you need to be able to bill, so I would put it in this comments section, interpreted by myself. Or you could put that all in the physical exam. EKG, chest x-rays, all this stuff you have to dictate or free text, or you could go over to results and copy and paste it. I would recommend saving your note first, but you could go to radiology images and just a regular copy and paste. I'm not getting the whole report. I'm just giving an example, and then go back to documentation, and it's not working on my home computer, but you can do it at the hospital very easily. I tend to just dictate a kind of quick summary, and always put who interpreted the X-ray, CT scan, ultrasound, whether it was interpreted by the ER doctor or interpreted by the radiologist. If you want to complete an NIH stroke scale, it should be right there. I think they're actually working on updating that right now, is why it's not. Same thing for the TPA inclusion and exclusion criteria. Now remember, whenever you don't give TPA to a stroke patient, like at all stroke centers, you have to put Y, out of the window, NIH too high, things like that. And then the medical decision-making portion of the chart. This is what really disappoints me with Paragon, because medical decision-making is the most important part of your chart, especially for billing, and it's blank here. We just have to take care of it all of ourselves. So I generally recommend putting your differential at the top. Differentials are very important for showing complexity of the case, and it prevents downcodes. For example, if you had a patient with abdominal pain that you worked up, did a CAT scan, and your end diagnosis was UTI and abdominal pain, there's a good chance that the CT is not going to get covered and you're going to get a downcode. But if you had a differential showing that you were worried about appendicitis, kidney stones, something more emergent, well, then you're not going to get denied the code. So differentials are very important. You want to be sure to put either by free text or drag in what you did for the patient. So you could say, ordered metabolic workup, CAT scan, rule out kidney stone, and you could type another reeval. I put all my revals under the MDM. They have this reval section here, but it's kind of weird. I'll show you in a second. But you can make this basically medical decision board as big as you want. Another reval, pain meds, IV fluids, patient stable, waiting results, and then you could go back in and put your final discussion. So this is where you're going to do your I recommend doing your differential, all your interventions, all your conversations, consults, everything, put it in here. And then your impression is you're going to list your diagnoses. Please put more than one diagnosis if there is some. This increases your complexity of your chart, so you don't have to just put abdominal pain. It'll be abdominal pain, UTI, hematuria, or if it's a chest pain patient, it could be chest pain, history of diabetes, accelerated hypertension, and if their creatinine was 1.7, you could put acute renal insufficiency, things like that. You want to just show how complex the patient is. Prevents a down code and gives you more billing, basically. So you can see things are just kind of jumbled up here. Like, I don't know why you would have a reeval underneath your diagnosis. Like, your diagnosis, I think, should be the last thing besides where the patient's going. So I don't put my reevals under here, and the date and times don't really do anything. A lot of this, by the time you start, will hopefully be changed. Just to make it more up to date, I'm trying to get some things rearranged. Like the discharge assessment is where I've been putting my prescriptions, what prescriptions I'm sending the patient home with, because with this system, believe it or not, they don't have a way to scan in what your prescriptions are going to be. So always put in the note where your prescription is. I do that under the discharge assessment. This will be changed eventually to prescriptions. For critical care time, you put your minutes here. Don't put the range, but put the actual minutes. And then, try to do a summary of why the patient was critical, what interventions you did, things like that. And so the disposition, location, condition, if you click here, I guess it's just not loading these at home, but if you click here, it's pretty self-explanatory that it's going to have, your med-surg tele, or your ICU. It's going to show, you could put who the admitting doctor was, or you could do all that in the medical decision making and reevals too if you just wanted to free text it. That's what I do a lot of. And then discharge, transfer, admit. So when you click these buttons, it does send a prompt to the tracker, like we talked about on the tracker video. So if I hit discharge, it's going to change it on the tracker to disposition to discharge. If you hit admit, it's going to show the clerk that they need to admit the patient. So I frequently sometimes forget to click this and then have to go onto the tracker and right click on the patient, hit details, and then change it from an active to disposition to discharge like I showed in that video. And then and you sign your note. Now I'm not going to sign this note, but when you do, it's going to bring up this prompt that we'll have the patient's PCP. Do you want to send the note to the PCP? Well, the list is wrong. Just hit skip every time. If you are co-signing a note, which I think I have some I can show you. Actually, let's just do that. So that's signing your note, and you're done with your documentation. Well, no, never mind. Procedures. So there's no pre-printed procedures. Procedures you would free text here. What I suggest is Googling macros for procedures and saving them in your Dragon, or you can just free text them or dictate them right here. If you do a separate procedure note like the central line note that they have populated, I personally would rather you just do the central line note here. But if you use the central line note that they have built, just please say C central line note, C moderate sedation note. I think there's a couple of other notes if you searched you could find procedures. But please say, see that procedure in this section. So I'm going to X out of this. I'm not going to save it. So I'm going to show you my action list. I think in a prior video my action list was empty, but now I have some things to do here. Okay, so it looks like there's some orders to sign off on. I'm going to skip that for now and go to the co-signature. So you'll see a co-signature. This is for NP's chart. You also have them for every patient that the resident sees and signs his note for. So you're going to hit Start Co-signing Document Process. And review the note. Now, it's important to really take a good close look at these notes because residents will frequently forget important sections of the chart. Mid-levels don't frequently give the correct diagnosis or the most billable diagnosis. We had some that just did very short sentences and it didn't equal the 4 elements of the HPI. So take a close look at them. See if there's anything you might need to add. Like I would go through and just put negative on a couple of things just because I want to prevent a down code and there's nothing here, at least negative for the, you could, click something like, oh no, you don't want to do that. I thought it would just highlight that. So family, something like that, you could review and not contribute, it doesn't matter. And it looks like, just as I said, this mid-level did not do a review of systems. So that's why, you can't just go down and sign, unfortunately. You got to take care of these notes. So at this point, you could tell the mid-level he needs to fix this, or you could do it yourself. Usually, if you just read what's going on, you could figure it out. Nausea, vomiting, dysuria for a couple days, subject to fever. So I'm just gonna go into review systems and do it myself. This is why Dragon is much easier than having to go through this. So, nausea, vomiting, and fever. And that should be okay because of this sentence right here. I've been told off and on in my career that this sentence counts or doesn't count, but the last I heard from our billing company is that sentence counts. Personally, I do a full one, but since I didn't see this patient, I'm just trying to make this billable at this point. So he at least had a couple of diagnoses under his assessment. That's something I probably would have put in the discharge instructions section, but whatever. And then you're going to hit sign. So for the PA or MP, it's automatic. They do this part for us. I saw the patient. They're saying they saw the patient and that we were the supervising doctor on, basically that we were available in the ER. And we hit cosign. Now, if it was a resident, we have to find the attending attestation note and sign it. That's real important. Trying to get that pre-populated so we don't keep missing them. But be sure to find that and sign it. Sign. This is the skip part I was talking about. And unfortunately, it leaves you back to the documentation part of that patient. So now you got to go back to the action list and see if you have any more to complete. So I don't have a resident one to show you, but this is why it's good to put in your own orders because it's a pain in the ass and slow to co-sign off of these orders. And I don't know why some orders come over here and some come to the deficiencies tab. But if you have them, you got to sign off on them. So you always have to hit the sign off and accept. And then submit prior actions. I don't know what any of that is, but that's what it takes to get it done. And then I'm not sure what this order sign off tab is. I've never had anything under here. They'll seem to all go to the action list. And then we can look at the deficiencies, if there's any here. None here, but we talked about what you might see in these sections. So let me see if I have anything else on my list for this. Nope, that's it.